It's Monday, April 25th at 12 a.m. Um, I was watching more videos because that's all I'm obsessed with now, watching videos and seeing more experiences from people and learning from them and everything else. But there is one topic where she was Banded Wendy. I've been watching, I guess I've been a little bit obsessed with watching Banded Wendy. I kind of want to go through her whole thing. Anyway, but she was talking about telling people about being banded. So far, I've only told 3 people. Three of, I guess, they're my close friends. I told Shawnee, and I feel like I can tell her, and she won't tell anybody else about it. And it's not that, I'm ashamed or anything, but I mean, she is my best friend, and I have to tell her things. I have to tell her things. And I told my other 2 friends. Um, and then I told my brother and my mom. And my mom told my dad, which I hated that she did, because my dad always thinks that we spring things on him and we don't talk to him about things. And if I don't tell him myself, like verbally, he thinks that we're trying to do something. I don't know. He's paranoid. My dad is paranoid. Um, and how to tell people. I don't know if I want to tell people that I'm getting banded, and it's not that I'm like ashamed of it. Okay, maybe partially, maybe I'm ashamed, um, especially about telling my family, the rest of my family, I guess, my aunts, my uncles, my grandma, the other side of the family, and because, um, I don't know, sometimes Hispanic people have this notion that if you don't do it the old school way, you're cheating, um, on anything, not just weight loss. Um, and it's something that they have to learn to accept, but I don't think they're going to learn to accept it yet. And I don't know what to say, but of course I hopefully will get banded, and they will. I will hopefully start losing weight, and they're gonna ask. Everybody's gonna ask. What are you doing? What's your secret, etc., etc. And am I gonna say I got banded, or am I just gonna say, well, I've been eating less, which is true, which will be true because I will be banded. It will be a true statement. It won't be a lie. Um, I don't know. I don't know what to say. Um, and then I especially don't want to tell my family right away or at all, because I've said before, my aunt, she is 6 months older than me, and she got it 2 years ago. But she had complications, and it had to be taken out. I mean, the band was successful. I think she lost about 80 pounds in 10 months or so. Yeah, around that time. Um, and but it got taken out because of complications, and she ended up gaining the weight back. Um, and so to them, they think that the lap band is not a sure thing. Which, sure, it's not a sure thing. Gastric isn't a sure thing. Weight loss by yourself is not a sure thing. Nothing is a sure thing unless you, keep going with it, work with it, not against it. And I'm trying to stay positive about it, and I don't want to jinx myself or whatever. I want to be successful with the lap band. And I don't know. I've gotten really paranoid. I guess I get it from my dad, of course. That I'm gonna get that stopping feeling, that dumping, I think they call it. I don't know. PB, who knows? I'm scared because I hate that. I would hate that feeling, and I wouldn't want to have that feeling with every meal. So I'm thinking maybe I should just stick to slider foods, and I don't know. I'm just paranoid. My patient advocate, Patrice, called me on April 14th to tell me that she had put in the request for my insurance to approve me for the lap band. It's been a week, and she said that it would take 2 to 3 weeks. The only thing that worries me is that I didn't have insurance until late 2005 or 2006, which means I only have weight records from 2006. I did visit a clinic in high school, and they should have my weight as well. I don't know. I'm still kind of scared, and it's only been a week. But I'm still freaking out. And I think that if they don't call me by next week, I'm going to start the pre-op diet. I heard some other guy on YouTube start the pre-op diet before he was approved, but he ended up paying anyway, like paying out of pocket. So he did his pre-op diet while waiting for the insurance. And so when they said, "Oh, start your pre-op diet," he said, "Well, I already started it. I already did it. I logged everything, and let's get this show on the road." And that's what I'm going to do. I want to get this show on the road. I don't want to wait another 2 weeks, because then I'll be counting down. It's another week. It's another week. It's another week. Well, I would only say it twice. Anyway, but I don't want to wait. I'm feeling, like I said, I've been feeling very anxious, and I'm very excited to start my new journey. I want to start the journey already. I want to be a loser and not a gainer. I was telling my mom how I'm so ready. I'm so ready mentally. I'm ready. I'm not even scared anymore. I thought that I was scared about getting surgery done because I've never had a surgery done. But I'm ready because having surgery done is just a smaller obstacle to what I want, and which is the weight loss, to being a healthier me and being a better looking me. But I just want it to be time. I want it to be that time. And so this week is going to be my goodbye to food week, and Sunday or Monday I will start my pre-op diet, and hopefully, I think that obviously people lose weight during the pre-op diet, so I want to be one of those losers. Even if I don't get approved for lap band, during those 2 weeks, I'll lose like 7 pounds. 7 to 13 pounds is the weight that I'm supposed to lose in those 2 weeks. So if I lose 7 to 13 pounds, I'll be good. Even if I don't get approved, I'll still have a gain, which is a loss. But yeah, that's it.